I am Dr. Keeling Perez, and I am the medical director for the Hyperbaric Center at Sacred Heart. The Sacred Heart Hyperbaric Medical Center is accredited by the UHMS, which is the Undersea and Hyperbaric Medical Society. We're actually the only accredited facility in the Lane County. When you're breathing air, 21% of that air is oxygen. And at sea level, you're under 1 atmosphere pressure. When you're receiving treatment on a hyperbaric chamber, you receive 100% oxygen with a pressure that doubles the atmosphere, and sometimes at 3 atmospheres. And the principle is essentially high concentrations of oxygen at high pressures will act on different ways in your body. It'll help you generate new blood vessels. It'll help you heal over the fibrous tissue that has been damaged either by infection or inflammation.
More traditional wound treatments deal with the wound from the outside in, and many times these wounds are not healing because the patient doesn't have the ability to get enough oxygen to the wound, or they have an underlying chronic infection. And the hyperbaric oxygen will force a large amount of oxygen into the tissues to enable healing, and it's also a very potent antibiotic, so it reduces infections.
The most common ones we see here in the hospital would be patients that are diabetic and they have a foot ulcer that is difficult to heal, that might have an underlying infection that is deep. Patients that have chronic infections of the bone, patients that have carbon monoxide poisoning, or patients that have had the BANS, which is commonly called decompression illness. On their arrival to the center, the patients are greeted by our technologists. There's an assessment of their vital signs. Following that, the patients would change into our surgical scrubs that are made out of a special blend designed especially to protect from fire hazard within the chamber. We pay special attention to the eardrums just because of the pressure changes within the chamber. Some of our patients have experienced some discomfort to their ears, and it's about the same feeling you'll have if you're flying on an airplane when the plane's taking off or landing, and if you're able to clear those up, then it's not painful at all. And the patients are laying down in a stretcher that has a gurney, and this gurney is wheeled in inside the chamber. There's a communication device, a microphone, or speaker that is built in within the chamber, so the patient establishes an initial communication with the technologist to make sure that they can be heard both ends. After that, we close the gasket of the chamber, and we start raising the pressure little by little, according to the patient's comfort. A treatment usually lasts 90 minutes of treatment time. The fact that we have increased our capacity and have 2 new chambers essentially tells you that the need is big, and the community is greatly benefiting from it.
By combining wound care services with hyperbaric therapies, you really offer the patient a cutting-edge, best practices opportunity to heal their wounds.
We coach them through the treatment process, and when they're having a hard time with their symptoms, we help them to cope. And when they improve with the treatment, we celebrate with them. So that creates a very close relationship with them. I think at the end of the treatment, they're happy that they're feeling better, and they feel very grateful.